Who here hates going to the dentist? Hands up. That's a pretty typical response. Now, why is this so? Well, isn't it obvious? It's mainly because of this and this. Nobody likes the thought of lying down, having your mouth prized open, and having the needle or the drill headed straight for your gums. Do you? As a dentist, I know people don't like coming to see me. But last year I had a patient whose reaction took even me by surprise. Her name was Mary. As Mary sat in my dental chair, she was trembling, literally shaking with fear. And then she started to cry. Now, clearly there were some issues I needed to be aware of here. So I said to her, Mary, why are you so upset? Mary proceeded to tell me the story from hell that had kept her away from a dentist for over 50 years. Mary was a carefree 8-year-old in rural England. She'd happily go off to school every day and come home to milk and cookies. But one day, Mary woke up with a raging toothache and was immediately sent to the dentist. It was her first time. So there she was, sitting in the waiting room trembling, because in the room next door, she could hear the drilling and the crying. And then it was her turn. Mary! The dental nurse led her in and plopped her down right in the middle of the metal, cold, hard chair and clammed her head back onto the seat with her large, heavy hands. Without saying a word, the dentist picked up the long, sharp needle. As Mary screamed, he stabbed it into her gums. And before waiting for the anaesthetic to even take effect, he started to yank on the tooth with the large silver pliers. Unfortunately for Mary, the tooth did not budge. Now, what happened next may sound impossible. In fact, when I first heard it, I didn't believe it. But it's true. The dentist, for better leverage, actually stood up and put his foot on Mary's chest and yanked. The tooth cracked and shattered. Mary screamed. But the worst was not yet over, because the dentist then had to dig and drill out the rest of the roots that were still buried underneath her gums. In the process, Mary passed out. Is it any wonder she's never been back to a dentist? The tragedy is that it doesn't have to be like this, because modern day dentistry is totally different. Instead of the squeal of the high-pitched drill, we offer you relaxing music. Instead of a big, long needle, like that, these days, the needle aren't that big. Instead of staring at the blank, impersonal, clinical white ceiling, we offer you DVDs, digital television, YouTube. The choice is yours. Advancements in technology means that treatment is quicker, simpler, faster, and less invasive. Results are longer lasting and more cosmetic. Now, an example of this is Invisalign. Who here has ever had the pleasure of wearing braces? Oh yes, lots of people there. Do you remember looking like this?
Oh, yeah.
Do you remember having your teeth bound down with the metal wires? Do you remember having the inside of your cheeks and your lips and your tongue getting cut open by those sharp metal brackets? Do you remember having your food getting caught in your teeth all the time and you can't clean it out? And most of all, do you remember being called a metal mouth at school? Yeah, anyone been there? Yep. Well, today, those times are over. There is a clear alternative. It's called Invisalign. You might not believe it, but this person here is actually wearing Invisalign. It's just about invisible. It's a series of clear plastic aligners that fits over your top and bottom teeth, and you get the same results you do with braces in the same amount of time. No metal, no pain, no discomfort. You take it out to eat and drink, so there's no difference there. And most of all, you can't see it. But don't just take my word for it. How about I get a volunteer to come up here? Oh, yes. Welcome, Ken. Come on down. So, Ken, have you had braces before?
Yes, it is. A 13-year-old.
You enjoyed your time having braces?
Yeah, we got the rubber bands.
Yeah.
That's how you would have looked with braces, yes? This is how Invisalign looks. You can barely see it, right? And it's easy to take on and off. You can try just pulling that off, on and off there. And it's pretty simple. So it's just a clear, custom-fit piece of plastic that goes over your teeth. You wear them for 2 weeks, then you move on to the next one. And then gradually... Thank you, Ken. Ken, thank you. You too can have a Colgate smile. Thank you. Ladies and gentlemen, that's how good modern day dentistry should be. I'm pleased to say that I was able to change Mary's perceptions about dentists. By the way, her choice of music was Akadaka. She had the happy gas before the needle, so she didn't even know that she had it. And by the end of the appointment, she had the smile of her dreams. Because Mary went from this to this. That's Mary. Mary's no longer afraid. She even makes regular appointments. She tells her friends, she tells her family, she's definitely a raving fan. So if you're like Mary, come and see us. If you know of someone like Mary, tell them about us. Or if simply you need a good dentist, here's my card. Here you go, darling. That's something, you can pass it along. Thank you. Thank you, guys. Thank you.